helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. Appreciate you being here. We're going to talk a little bit about the new Children's Hospital coming into Huntington. Melanie Akers is with us. Melanie is from the Hoops Family Children's Hospital that they're still developing, still working on. You've seen some on the news too about this. And Melanie, first of all, we've already talked a little bit about pediatric care and all the work that's going on. How is Hoops changing this? What is Hoops about?
Well, as you know, Cabell's been known as a leader in pediatric care for many years. We've always provided high quality pediatric care. And by becoming an official children's hospital, we are a member of the Children's Hospital Association. It gives us access to resources that help us further improve quality and patient outcomes.
We have also talked a little bit about some of the enhancements that will go on with this. What will children see when they go in when this is all finished?
Yeah, well, even now in our new little section of 8 rooms, visually it's much better. When they walk in, they see something friendly and playful versus the normal, sterile looking, typical hospital environment.
We're showing some of the pictures that we've garnered of this so far. That was the ribbon cutting, and explain what that is.
That is a section of the patient room. That area is the family area. So the family can have a separate area from the child where they can have privacy, they can pull the curtain, and hopefully be comfortable during their stay.
And obviously a little different feel for families and for the patients. Talk a little bit about how the child who becomes the patient will sense a difference.
Well, absolutely. When the child is in their room, first of all, the rooms are significantly larger, and that allows the family to be there as a support system more comfortably and easily for the child, which is very important. The child's room, there are amenities in there that they can change the color of the lights. They can have some control over things that are happening to them, plus have fun while doing so.
Very tough, because when you're talking about any patient in the hospital, it's not easy on any family, but it is very difficult when you're talking young children. How do you cope with that very young child aspect of having a patient there?
Well, even a young child, when they're ill, they still feel playful. So it's important to still treat them as a child and allow them to do some of the things that they would typically do. Play games, interact with other children, and be there with their family.
Interaction with other children, I would think, would also be interesting, because you want them to have fun. Yeah, I mean, we're looking at a playroom.
Absolutely.
And yet you want them also to get the treatment and take care of themselves in a proper way, but those go to kind of hand in hand, don't they?
They do, and thanks to having a new improved playroom, we have more space where children can get out of their rooms and interact. We will have scheduled activities like movie nights, making crafts, things like that to get them out and interacting.
The families that you're starting to see at the Hoops Family Hospital, they have an attraction to this too. There is a desire for this, isn't there?
Absolutely. Many of the patients and families that we see are already coming from hours away to get to our facility, and so we are hoping to further attract different specialties and things so we can keep people here at home rather than sending them even further to somewhere else.
We've seen some of the pictures. You saw the ribbon cutting there. Not all of this is finished. Where do you go next in the construction process?
Well, we moved patients officially into our first 8 beds this week. Next week begins the next phase, which is the new PICU. That phase will take 7 to 8 months. Once that's finished, so we're looking at February.
And tell people what PICU means.
Pediatric Intensive Care Unit.
You work inside it, and so you always call it that.
Absolutely. 10-bed unit that will move into the new unit in February, and after that they will complete the remaining 17 general pediatric beds to give us a total of 25 private pediatric rooms and 10 pediatric critical care rooms.
So this becomes a whole separate hospital unto itself, basically within Cabell Huntington Hospital.
Hospital within a hospital, absolutely.
And when will we see the whole project complete?
Around October of 2015.
So this is a long ongoing process.
About 18 months from now, yeah.
While the first 8 rooms are being used, though, I'm gathering that's not where the construction is happening.
Right, we're working around it right now. We are working in phases. We're kind of split. It's a
development
challenge,
as it goes.
Absolutely.
Well, we appreciate you being here, Melanie. If you want to learn more about this, it's very easy. You can go to WSAZ.com, click on our Moms